Hello and welcome back to my channel. My name is Dr. Adeze Ifezulike, and today I want to talk to us about dementia, a very important illness. Dementia is now the top killer of people in the United Kingdom, and it's not different from the rest of the world. Dementia rates are increasing. It is estimated that 1 in 3 people would have dementia. So it's an important topic, and I'm here to discuss it, break it down for us. Let me start by telling you what happened to someone I know personally. When I first came to the country, my father, who was a public health physician, told me about his student who was living here in the UK. And he said, when you go to UK, connect with him because he's a good man. So I did that. When I came, I connected with this man. Let me call him Professor B, Prof B, just to protect him. And so we connected. He was a wonderful man. We had lots of time, lots of hours just chatting and talking. He was a great mentor to me. I just loved him. He was wonderful. And then I got busy with being in a new country, looking after children, family life, trying to have a career and all that. So I completely lost touch with Professor B. And it was many years later that I met his son at the airport. I was so excited to see his son. I was like, "How's your dad? How is Prof B?" And so what he told me wasn't good news at all. But I thought it can't be that bad. I said, "Give me your dad's address. I'll go and see him." Because I just felt, when I see Prof B, he's going to remember all our times together, all our discussions, those hours of mentoring he poured into my life. So off I went to go and see Prof B. My first shock was that the place where he was staying was a nursing home. And I'm thinking, why is Prof B in a nursing home? Because I know him to be a very capable man, a professor, very intelligent man, very capable man. So I was shocked to see him in a nursing home. And at that time, he was just 70. He had just turned 70. So it's not like he was very old. So I got to him, and with all my excitement, Prof B, it's a day. I got to him, I was smiling, I was so happy to see him. I know what he said to me. He smiled back and he said, "Sorry, who are you?" And I'm like, it's me, it's Adeze. But didn't you remember? Don't you remember me? And he smiled again and he said, "Sorry, who are you?" I was to find out that that's the same question he asks everyone that comes to see him. Even the people that are looking after him all the time, he's always asking them, "Sorry, who are you?" Professor B had dementia. At the young age of 70, he had dementia. I was told that he couldn't stay in his own home. He would start cooking and forget he was cooking and cause a fire in his home. He would wander out in the streets and neighbors and strangers will have to bring him back home. It was very unfortunate. So his family had to put him in a nursing home. And I felt so bad because I knew him as a very capable man. If someone told me that Prof B will have dementia, I would not have believed it. But that's why the statistics are so, shocking that 1 in 3 people will have dementia. So it's something we need to talk about, okay? So you might be wondering what is dementia. I've got a definition here for you. And this definition, I'll do a simple one first. It says dementia is like when someone's brain gets sick and makes it hard for them to remember things or to think clearly. It can also make it hard for them to do everyday activities like getting dressed or talking with friends. But if you want a medical definition, the definition medically is dementia is a progressive and irreversible clinical syndrome with a range of cognitive, so thinking, and behavioral symptoms, including memory loss, problems with reasoning and communication, change in personality, and reduction in the person's ability to carry out daily activities. So that's the definition of dementia. And there are two main types. I'm sure you've heard about Alzheimer's dementia. That's the main one, accounting for about 75% of cases. And in that type of Alzheimer's, there's atrophy of the brain. The brain is dying down. there are plaques, insoluble materials in the brain, there are tangles of nerves, and there's reduction in neurotransmitters. Neurotransmitters are the messengers that the brain needs, the chemical messengers the brain uses to do its function. So there's a reduction in all that. So that's one big type of dementia, Alzheimer's dementia. But you also have vascular dementia. This sort of dementia is one where the blood supply to the brain is not functioning. Okay, so there's a vascular problem. There's a problem with the vessels that feed blood to the brain. Okay, and there are other types of dementia. I won't go into them. The main ones are the Alzheimer's dementia and the vascular dementia. Now, like I said, 1 in 3 people are estimated that will have dementia. So it's really something we need to talk about. Dementia affects everyone. If someone has it in the family, it's a major, major load on all the family. And it's heartbreaking to see someone, your mom or your dad, someone who was quite capable, now so forgetful, doesn't know what he's doing, sometimes wetting himself, just walking around, leaving the house. It's really heartbreaking. But it's not all doom and gloom. And there was a recent paper by the Lancet journal. Lancet is a well-respected medical journal, and they set up a commission to look at dementia prevention, dementia care, and intervention. And they synthesized all the sort of available evidence. So they wanted to give an objective, evidence-based advice for everyone that will help to reduce the global burden of dementia. And so they came up with 14 modifiable factors. There are 14 things we can all do. And they said if we modify these factors, then we'll be able to prevent nearly 50% of dementia cases. Isn't that amazing? That nearly 50% of cases of dementia will be prevented if we can modify these 14 risk factors. So I'm going to take us through the 14 risk factors because it affects everyone. We all need to know and learn it. If it's so bad that 1 in 3 of us will have dementia, then I think it's useful that we get to know what we can do to prevent this horrible, horrible disease. Okay, so the first one there is, so what they've done is these factors, they've classified it into early life, the ones that should be done in early life, then midlife, and then later life. Okay, so in early life is education. They say if people are properly educated to the best of their ability as much as possible, that we can prevent 5% cases of dementia just by education. So making sure our children are educated as much as they can go, good primary education, good secondary education, and encourage them to go even further. Be educated as much as you can. That will reduce your chance of dementia. And you may be wondering, everyone is being educated, but no, mind you, that a lot of children are beginning to stay out of school due to anxiety, due to depression, due to bullying in schools or cyberbullying, online things happening. So a lot of children are missing out on education. And as the rates of illiteracy rises, it's likely, and it goes from their study, that the rates of dementia will rise with it. So we need people back in study, back in school. And if you're an individual listening to this, don't feel that, well, there's nothing you can do. You can begin to work on your mind. You can begin to learn new stuff. You can begin to encourage your brain to learn new stuff. Otherwise, you're setting yourself up for dementia. So 5% cases of dementia will be prevented with good education. And it's a lifelong thing. Okay, even as an adult, you can keep educating yourself. It will really help prevent dementia. Now, the other factor when you come to midlife, they talked about was hearing loss. And it says that hearing loss will prevent, if we tackle hearing loss, we can prevent 7% cases of dementia. That is amazing. Because we come from a culture where if someone is maybe in their 60s, they're not hearing very well, we just assume, well, they're 60, so there's no point, doing anything. No, this is showing us that if you have a hearing loss, or or your parents or whoever, encourage them to go and get their hearing tested and encourage them to wear hearing aids. It will reduce their chance of dementia. It says by 7%. That is significant. That is significant. So those who have a hearing loss, wear your hearing aids. Then we should protect our hearing. Young people, protect your hearing. Don't play your music too loud to your ears. Don't damage your ears, because that will increase your risk of dementia. Okay, so that's hearing loss. The next thing is high LDL cholesterol. You must have heard of the so-called bad cholesterol. And they're saying that if you don't tackle bad cholesterol, you have 7% cases of dementia just from bad cholesterol. And where do we find bad cholesterol? In processed food, in all the rubbish food we eat. They often contain trans oils. We need to be mindful of what we put into our bodies. Okay, cholesterol comes mainly from animals, from animal products, from your beef, your egg, even your animal milk. All those things have cholesterol. They should all be taken in moderation. But we need to eat more plants, more plant-based meals. Plants don't have cholesterol, and eating plants improves your good cholesterol. Okay, so that's one way we can tackle that, and that will prevent 7% cases of dementia. So that's huge. Now, the next factor they talked about is depression. And they said by tackling depression, we can prevent 3% cases of dementia by tackling depression. So the fact that you're depressed is bad enough. Yes, you're unhappy, things are really down with you, but you need to tackle that, because it's predisposing you to dementia. Depression means that you might isolate yourself, you're not mixing up with people, your brain is not being stimulated, you're practically shutting down your brain through your depression. So we encourage you, if you feel depressed, speak to a doctor. You might need counseling, you might need a psychologist, you might even need a psychiatrist, you might need medication. There are different things you can do. And if you don't want to take medication, there are lifestyle changes. Exercise is great for tackling depression. Okay, so please do something about depression. Don't ignore it. Okay, the other factor they talked about is physical inactivity. If you're physically inactive, you are setting yourself up for dementia, and it gives it a score of 2%. If we can tackle physical inactivity, 2% of cases of dementia can be removed. So if you're physically inactive, please get up and move. Really important to have a lifestyle where you're physically active. And it doesn't mean you have to be going to the gym. If you love to go to gym and you can go, that's fantastic. But even getting up, making sure you walk every day, you're on your feet, you get in your steps, okay? Get get a step counter. Make sure you're getting enough steps. 6,000, 8,000. Push yourself. 10,000. Some get 20,000. But push yourself. Do a bit more. Okay. And even I see a lot of patients who have arthritis of their knees. They can't walk far. They're seated all the time. And I say to them, even if it's get up from the chair, up, sit back down, up, sit back down. Do that 50 times a day. Do that 100 times a day. That is being active. So at whatever level you are, you can do something. Please do something to reduce your risk of dementia. Now, the other factor they talked about was diabetes. Diabetes accounts for 2% cases of dementia. So by tackling diabetes, we know what diabetes is: blood sugar problem. Diabetes is horrible. It accounts for a lot of blindness. It accounts for limb amputations, for kidney disease, kidney failures, and people needing dialysis. There are lots of things that diabetes causes. So if you've been told that you have diabetes, make sure you are making it a priority to tackle your diabetes. I have lots of videos on reversing diabetes. Please go and watch them. You'll find them really useful. The best thing you can do for yourself is to reverse your diabetes. It will reduce your risk of dementia too. Okay, so the next factor is smoking. Smoking causes 2% cases of dementia. If we can tackle smoking, we'll immediately be able to wipe out 2% cases of dementia. If you're a smoker, I encourage you to stop. There's no benefit whatsoever to smoking. There's no health benefit. You might have taken smoking as a coping mechanism. Why don't you look at other coping mechanisms? And there are other things you can do as a way of relaxing. For example, speaking with a friend. For example, going for a walk. I know some people use smoking as a way to, relax themselves or to distress. But can you think of other ways? Watching a comedy. There are other things, okay? But please stop smoking. Ask your doctor for nicotine replacement therapies that may help you. The patches, the gum, nicotine gums, nicotine patches, and so on may help you come off smoking. But I encourage you to stop smoking. Okay? Now, the next factor they talked about is hypertension, high blood pressure. Hypertension causes 2% cases of dementia. Because remember, high blood pressure damages the blood vessels. And we told you that a type of dementia is the vascular dementia, in which the blood vessels are damaged. The blood flow to the brain is not working as it should. Hypertension is one of the causes of that. So really important. People often tell me, oh, I only take my blood pressure tablet when I'm feeling like my blood pressure is high. And I say to them, you can't feel it. It's not a feeling. It's not a feeling. Your blood pressure can be high, it can be through the roof, and you're not feeling it. And the first time you know it is when you have a stroke. So please, many people do not feel high blood pressure. It's something that needs to be checked. And if your GP has told you that you have high blood pressure, you need to buy a blood pressure machine. Okay, you need to own one. It's not expensive. In the different shops, you can get them for £12, for £15, for £18. It's a good investment for your health. When you have it, then you can check. You can check at home. The readings you get at home are actually more accurate than the one the doctor does for you. Because sometimes when you come in to see us in the clinic, you're a bit tense, a bit worried, a bit unsettled. The blood pressure will be high. But if you're doing it at home and you're getting normal readings or it's still high, then you need to make sure you take medication. And there are lifestyle changes that can help high blood pressure too. Okay, those are things, if you follow my channel, I talk about all those sort of lifestyle things. Really important to do them. Okay, the next factor was obesity, accounting for 1% cases of dementia. If we can tackle obesity, you as an individual, do you know your BMI? BMI is not a perfect tool. It's not a perfect tool, but it's a good starting point. Okay, make sure your weight is within the right BMI for you. Do all you can to stay on top of your weight. Again, I have videos on how to lose weight and so on. Please follow my channel. Go and watch those videos. You'll find them really useful. But obesity is a risk factor for dementia. Okay, now the next one is excessive alcohol. Excessive alcohol. Now, we used to encourage people, men, don't drink more than 21 units of alcohol. Women, not more than 14 units of alcohol. But now we are being told that there's no safe limit of alcohol, that nobody really should be taking alcohol. Nobody. So the safe limit is 0. But I know alcohol is so important in a lot of cultures. It is the way we socialize. It is the way we mix up with people. Alcohol is such an integral part of a lot of our lifestyles, but we can cut right down. Okay, we can cut right down and even do what we can to stop. We can, or if you have an alcoholic drink, your next drink should be water, a glass of water before your next alcoholic drink. Okay, try and space out your alcohol. Try and not binge. Some people don't drink the whole week, but at weekend they then drink a lot. That binge drinking is dangerous. So alcohol predisposes to dementia, and it can actually cause the early onset dementia, the dementia that we're seeing in young people. I know a gentleman who is 48 and he has dementia from alcohol excess. So alcohol will predispose you to dementia. The next factor is now in late life. In late life, there are 3 factors there. Number 1 is isolation. If you're isolated, it can lead you to dementia. It causes 5% cases of dementia. Social isolation. Don't be lonely. Try and mix up with people. Even if you like your own, you always want to be by yourself, you're not stimulating your brain. That interaction with other human beings is good for brain stimulation. Okay, so even if you're an introvert, like I'm an introvert, but I also make an effort to mix up with people. It will help stimulate your brain. So isolation, being just isolating yourself from friends, from family, is not good. It predisposes you to dementia. And if you're isolated because you have a difficult personality, you can change. You can change. It's never too late to ask yourself, why is it that I don't have friends around me? What are the issues? What can I do to be a better friend? To be able to have, I mean, I'm not talking about having a crowd of people around you, but even if you have three good friends, that's great. If you have two good friends, that's great. But you need people. We are social beings. We are social beings. We need the company of other people. And now we're seeing that social isolation causes dementia. So the next factor is air pollution. Air pollution accounts for 3% cases of dementia. 3%. So what people inhale, if we're inhaling things that are polluting the air, those things go to the brain and cause inflammation. They cause oxidative stress to the brain. They damage the brain tissue itself, the brain vessels. Air pollution. So we need to make sure we're in an environment that is not polluted. Do what we can. Of course, it's really important that the policy makers, the regulators, the lawmakers take this to heart. Make sure that people are being held accountable for polluting the air. If there are industries that are releasing all sorts of things into the air, they must be held accountable, because now we know that those things are not just a matter of the air doesn't smell good. We're actually inhaling substances that inflame the brain and cause dementia. Now, the last factor is visual loss. Vision, we need to look at our eyes. Make sure that if you have cataracts, go and get your cataracts sorted, or you have glaucoma, or whatever, you've been told you need to wear glasses, please put on your glasses. You need it to stimulate there are places that need to be stimulated in your brain. If you cut off your vision, or you're not seeing as well as you should, or you say, well, I'm no longer in school, I don't need to see the board or anything like that, you still need good sight. It accounts for 2% cases of dementia. So please look into your vision. Make sure you see the optician, you have your eyes checked. Look after your eyes, okay? And young people, a lot of young people use contacts because they don't want to wear glasses. I get that. I get it completely. But if you're using contact, make sure your hands are nicely washed and you're careful how you put things in your eyes. Okay, so those are the 14 things we talked about in early life. Education, we talked about in midlife, hearing loss, high bad cholesterol, LDL cholesterol, depression, traumatic brain injury. I missed that. Traumatic brain injury. Sorry, I missed that. That is also a factor. And what they mean by you might have an accident that, where you then hit your head, there's trauma to your head, or you have continuous trauma to your head, like people who are boxers, people who do contact sports. That means that they get some impact to their head. That has been associated with increase in dementia. Okay, up to 3%. 3% cases of dementia are due to traumatic head injury. You need to protect your head. If you're a boxer, make sure your head is protected. Are young people going into boxing? Make sure your head is protected. We don't want, when you're in the prime of your life, when you're the time you start boxing, when you're 18, by the time you're 30, you're beginning to show signs of dementia because of traumatic head injury. Let's protect our heads, okay? So we talked about that. Physical activity, we talked about diabetes, smoking, hypertension, obesity, excess alcohol, social isolation, air pollution, and visual loss. 14 modifiable factors. And the Lancet paper says that if we can modify these 14 things, we'll be able to push back nearly half of cases of dementia. So I really think we all need to have a look at that, sit up and modify these risk factors to prevent the raging inferno of dementia. So I hope this has been useful. I would love to hear your thoughts. Which factor do you think you can work on? Put it in the chat. I would love to hear from you. Do you have an elder, a father, a mother who has a vision loss, and now you know you should go and let them see the optician so you don't push them into dementia? Or someone has a hearing loss, you've not bothered to go and see the ear people, get hearing aids. Which factor resonates with you? Please drop it in the chat. I would love to hear from you. Thank you once again for watching my channel. Please subscribe. Please subscribe. I keep seeing from my back room that so many people watch my channel, but they're not subscribing. It's free to subscribe and it helps me to keep the channel going. So please click the subscribe button. It's free, and I'll see you in my next video. Thanks for watching. Bye.